Question, member from Thornhill.
Very much, Speaker. Thank you, Speaker, and thank you, everyone. My question is to the Minister of Health as well. In the 7 years since the Vaughan Health Campus of Care was created for the purpose of bringing a hospital to Vaughan, families in the region have raised over $6 million. In addition to fundraising, Minister, Vaughan families have been paying for a new hospital with a special assessment on their property taxes. Your ministry approved and funded master planning and a plan for Vaughan Hospital to work in tandem with York Central Hospital. Why have the McGuinty Liberals spent the money hard-working Vaughan families pay for a hospital on eHealth and all the consulting and expense boondoggles of eHealth 2.0?
Minister.
Speaker, that does not bear a passing resemblance to truth, Speaker. This is a government that has very deliberately improved our health care system. We have more than 10,000 more nurses working, Speaker, in the system. We have close to 3,000 more doctors working in the system. When this party left office, people were waiting an unconscionable.
Stop the clock. The members please come to order, and the Minister of Finance will please come to order as well, too. That's from all sides. Minister.
Speaker, we have improved the quality of care in this province, and we are continuing to improve the quality of care. When we took office, Speaker, people simply could not find a family doctor. Now we have a much better, almost 1 million more people attached to primary care, Speaker, and every step we have taken, they have opposed.
Working. It's not just the families of Thornhill and Vaughan who have been cheated of frontline health care by your decision to spend on greedy consultants instead. McGuinty Liberal health care cuts forced Cornwall Community Hospital to reduce surgeries by 10% and close 8 beds. Northumberland Hills Hospital has had to close a diabetes clinic and cancel outpatient rehabilitation care. While you couldn't find money for frontline health care, you handed one consultant $422,000 in salary and fees plus more for his junket to Chicago and long-distance bills. You even paid $600,000 to a consultant who advised on how to deal with budget shortfalls. Why did you spend millions of dollars on consultants who cheated Cornwall and Northumberland families out of frontline care?
You know, Speaker, any way you measure frontline care in this province, it is substantially better than the way we found it, Speaker. We've got 19 more MRI machines. We've got double the number of MRI hours. We've been able, Speaker, to make a dramatic difference for people who are waiting for hip replacement surgery, waiting for cancer surgery, waiting for cataract surgery. Speaker, this party left our healthcare system in shambles. We've spent the last 7 years cleaning it up, and you know what? They want to do it all over again because they want to cut healthcare spending by $3 billion. You cannot cut $3 billion out of healthcare and improve quality of care at the same time. The people of this province deserve to hear from these folks because they say they can cut $3 billion and not cut service. I don't believe them, and I don't think there's anybody in this province that does. They owe it to the people of this province to say what.
Thank you.